Hi, welcome to the COVID-19 Regional Response Team review of the RRT. Today I'll be going over what is the RRT, our overall vision, our functions, and our operating principles and commitments. What is the RRT? So the Regional Response Team is the RRT for short. It's a collaboration of nonprofit, public, and philanthropic organizations that are creating a centralized system of response to meet the social needs of community members most adversely impacted by the COVID-19 pandemic in the greater St. Louis region. The RRT recognizes that those most adversely impacted by COVID-19 have also been imperiled by the long-standing racial and economic inequalities, including African Americans, people of color, older adults, people with disabilities, medically vulnerable and underserved populations, low-income individuals, essential workers, frontline healthcare providers, and others. As you can see in our map, our geographic area of focus is St. Charles County, St. Louis County, St. Louis City, and as well as our Illinois partners in Madison County and St. Clair County for a bi-state regional effort to address the impacts of COVID-19. Our overall vision for the RRT is we envision a greater St. Louis region that responds collaboratively, equitably, and effectively to the needs of our most impacted neighbors and communities in the context of the immediate COVID-19 pandemic and the long-standing pandemic of systemic racism. We evolve through these crises by understanding new approaches to partnership and advancing changes in values, relationships, and structures that remove race as a predictor of people's life outcomes. The core functions of the RRT is working to build a centralized system of response with the capacity to strengthen the resilience and recovery of the populations most affected by COVID-19 and the structural inequalities that amplify its adverse impacts. The primary functions of the RRT are to identify the needs of the most vulnerable in the region, sharing information about emerging and evolving dynamics and conditions on the ground, as well as effective solutions and approaches. The other primary function of the RRT is to evaluate the needs and priorities that the RRT is uncovering to the funder community in ways that mobilize impactful funder investment. The RRT also functions in deploying resources to meet needs quickly and in coordinated ways, heightening stakeholder awareness across sectors of the needs, priorities, and coordinated response efforts that are underway, and advancing systems transformation to engender a more effective and equitable delivery of services and resources across the region. The RRT has a set of operating principles and commitments with those principles. The commitments are to center racial equity and a commitment to anti-racism in all our work, partner intentionally with impacted individuals and communities, orient towards urgency, solutions, and coordinated regional action, and adopt the Robert Wood Johnson Foundation's health equity principles. The first operating principle to highlight is to center racial equity and commitment to anti-racism. Our first commitment is that the RRT is not going to just focus on mere recovery from COVID-19, as that will be an unjust baseline and is inadequate. Individuals and communities most impacted by long-standing racial discrimination, disinvestment must be the focus of our regional transformation. We won't be able to actually make real change that is rooted in anti-racist practices unless we engage those that are being impacted by these decisions the most. Economic development in historically disinvested communities must be prioritized. And we identify and change white supremacy culture in our organizations to identify anti-racism frameworks. Some of those examples are including power holding, either or thinking, or perfectionism. Tima Ukan is one individual who has shared some of these anti-racism anti-racism frameworks. And there are others that the RRT will continue to lean into and learn from as we develop our role together. The next operating principle is partner intentionally with impacted individuals and communities. Impacted individuals and representatives of impacted communities are part of the decision-making process. That means we authentically engage individuals. We work towards building trust in community and understanding the needs of individuals to address those. We recognize and respect the strengths, assets, wisdom, and resilience in impacted communities and acknowledge the need for resources to support community-based organizations. We hold ourselves accountable for inclusion and make meaningful changes when we fall short. And we share our work with impacted individuals and communities broadly and transparently. The next operating principle is an orientation towards urgency, solutions, and coordinated regional actions. As we orient our work, these are our commitments. We bridge the bi-state region in our activities, recognizing that no single jurisdiction, sector, institution, or organization can create systemic change alone. This is going to take all of us to do this work together in a coordinated, collaborative, trauma-informed way. We leverage the unique strengths of the individual organizations to contribute to shared goals. We align with existing disaster responses such as SLARC or the regional COADs in a time of crisis. We recognize that there is work that has already happened that pre-exists before the RRT, and the RRT is here to leverage these partnerships, work together, and address community needs in a way that truly centers those that are being most impacted by adverse conditions. And we act with urgency to address needs in and out of moments of crisis. The next operating principle to highlight is adopting our Robert Wood Johnson Foundation's health equity principles. Our commitments with Robert Wood Johnson Foundation's health equity principles include disaggregating data by race, ethnicity, age, disability, and other demographics so that we are always approaching any problems that are occurring in community with an intersectional lens. We identify and address policy gaps while advocating for federal support. We establish and empower teams dedicated to promoting racial equity in response and recovery efforts, as well as invest in healthcare, public health, and social infrastructure to foster resilience. This is really important as we work together to add on these health equity principles. And the last Robert Wood Johnson Foundation principle is we include in decision-making the people most affected by health and economic challenges and benchmark progress based on their outcomes. So these are the overall RRT principles and commitments. I've also gone over our core functions, our vision, and who the RRT is. If you're interested in learning more details, you can do so by visiting c19rrt.org. Thanks today for joining to learn more about who the RRT is. Bye.